I'm your student nurse today. My name is Maria. I'll be helping your nurse do a head-to-toe assessment on you if that's okay.
All right.
Okay, I just provided you some privacy and I'm also doing some hand hygiene. Okay, and a head-to-toe assessment is just me making sure that your reflexes are good and listening to your heart and your lung sounds. But if you have any questions along the way, just let me know. Do you have to go to the bathroom before we get started? No?
No.
Okay, that's good. Now, it will last 10 to 15 minutes, and I am a student nurse, so it might take a little bit longer, but just let me know if you have to go to the bathroom at any time.
Okay.
Okay, can you verify your name and date of birth for me?
Brenda Ramo, 3/21/97.
Okay, Miss Brenda, and do we have any allergies?
No.
Okay, good. Excuse me. And how are you feeling today?
Good.
Good. And are you experiencing any pain on a scale of 0 to 10, 0 being no pain and 10 being the worst pain imaginable?
0.
That's good to hear. All right. I'm going to also ask you a couple of questions, and I'm just raising the bed to help me do your assessment so that way I don't hurt my back. Okay, push this down. Okay, can you tell me where you are?
The hospital.
And what are you here for?
Head-to-toe assessment.
Okay, and can you tell me the year
2024.
and the day of the week?
Thursday.
Okay, patient is oriented and alert ×4. Okay, now I'm going to be checking on your eyes, just making sure your pupils are good and reactive. Okay, look at me. Okay, pupils are 3. Okay, this light's gonna be bright. You can look at me or straight back, and I'm just gonna shine it into your eyes a couple of times, okay? Good. Okay, and if you would look at my pen, and then look straight back. Awesome, pupils are equal, round, and reactive, and they accommodate to light. Oh, I'm also going to check the inside of your mouth. Can you say ah for me? Okay, mouth is moist, pink, and intact with no lesions. Okay, and now I'm going to be listening to your heart sounds in a couple of places. I'm going to start with your aortic valve, which is second intercostal on the right side.
Okay.
Okay, and now moving over to your pulmonic valve, which is also second intercostal, but on the left side. Now tricuspid, fourth intercostal, left side. And your mitral, gonna lift your shirt up a little, which is fifth intercostal, mid-clavicular, left side as well. All right. Now that I've looked at your chest, I'm also going to listen to your lung sounds and make sure everything's good. And those valves sounded clear and even. If you would sit up for me. And I'm going to place my stethoscope on a couple of different places. So every time I pick it up and put it down, if you would just take a good breath in and out, okay? Lift your shirt up a little. Okay. And if you would mind come sitting on the edge of the bed for me, I'm also going to check your lung sounds on the back.
shirt up a little.
Okay, thank you so much. Lungs sound clear in all lobes, in all 5 lobes. Okay, and now I'm just gonna take a look at your stomach area to make sure everything looks good. And I'll also do a listen and a little feel. Okay, having a look. Abdomen is non-distended and flat. And now I'm going to listen. I'm gonna start in your right lower quadrant and listen for up to a minute. And move up to your right upper quadrant and listen for a minute. Left upper quadrant and listen to him for a minute. Left lower quadrant up to a minute. All right. Bowel sounds are active, and now I'm just going to be feeling and I'm going to palpate to feel for any abnormalities or hard masses. Have you been having okay bowel movements?
Yes.
Any abnormal nausea or vomiting, anything like that? Okay, and when was your last bowel movement?
7 this morning.
That's good, and everything seemed to be okay?
Mm-hmm.
All right, now I'm going to check your radial pulses. Okay, radial pulses are 2+ bilaterally, and now I'm going to check your brachial pulses. Brachial pulses 2+ bilaterally, and now I'm going to check your grip strength. So you're just going to grab my fingers and squeeze as hard as you can. Grip strength good and strong. And now I'm going to check your skin turgor, and it's just going to be a little pinch. It just helps me see how elastic your skin is and how hydrated you are. Okay, skin turgor cups back under 5 seconds. And now I'm going to blanch your fingers and check for capillary refills. Capillary refills in 3 seconds or less. And now I'm going to check capillary refills on lower extremities. Back in 3 seconds or less. I'm also going to check your dorsalis pedis pulses right here on the top of your foot. Okay, dorsalis pedis pulses 2+ bilaterally. And now I'm going to do your plantar flexion. So once I put my hands at the bottom of your feet, push down like you're pressing on a gas pedal. Okay, and now I'm going to do your dorsal flexion. Now bring your feet up. Okay, dorsal flexion and plantar flexion are good. Okay, and I believe that's everything that I needed to do for your physical assessment. I'm going to raise your bed rail up, put your bed down, and I'm going to give you a call light. So if you need anything, just press it, give me a call, okay?
All right.
Thank you so much for letting me help your nurse do your physical assessment.
Yes, ma'am.
All right. Have a good day.
You too.